Let your heart shine bright. Let us take you to what is right. Let your heart shine bright. Let us take you to what is right.
Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Sayyidil Mursaleen. Amma ba'd, fa'awdu billahi min shaitanir rajim. Bismillahir Rahmanir Rahim. As-salatu wassalamu alayka ya Rasulallah wa ala alika wa ashabika ya Habiballah.
Wa ala alika wa ashabika ya Habiballah.
As-salatu wassalamu alayka ya Nabiyallah.
Salatu wassalamu alayka ya Nabiyallah.
Wa ala alika wa ashabika ya Nurallah.
Wa ala alika wa ashabika ya Nurallah.
MashaAllah. Viewers of Madani Channel, welcome to the Silsila Tonight with Madani Channel. And inshallah tonight we're going to talk about an issue that we'd like to think that doesn't happen. It's something that it's almost a taboo subject that we brush under the carpet and we talk very rarely about. And what is the topic? The topic is suicide. With regards to the topic of suicide, again, like I said, it's something that as a Muslim community, we brush under the carpet. It's something that we don't talk about. It's something that we don't really recognize as a problem. But unfortunately, it does exist. And it is existing in our society. It's not something that is just restricted to what you would call the Western civilization. It is found in the Muslim community. Even though, as Muslims, we all know that it's something that's clearly prohibited in Islam. Allah Azza wa Jalla says in the Quran, and I'll give you the translation, and do not kill yourselves. In another ayat, Allah Azza wa Jalla says, and do not throw yourselves in destruction. So the Quran itself, it makes it clear that our life is sacred. Life cannot be taken without justification. The right of life is inherent in the tenets of Islam. Life itself is a gift from our Creator that we are obliged to take care of. It's our responsibility to take care not only of our lives, but of our well-being as well as our health as well, and to look after our bodies from a physical point of view as well. So suicide out of despair of God's mercy or worldly problems is strictly forbidden. The Prophet Muhammad sallallahu alaihi wasallam said that whoever kills himself with something in this world will be punished with it on the day of resurrection. It is a major sin, and its punishment is subject to the will of God. If He wills, Allah Azza wa Jalla, He will forgive, and if He wills, He will punish. So it is a topic that we need to at least admit is happening within our society. And alhamdulillah, this week we have with us, mashallah, we have with us Harun Bhai. He's with us this week. But alhamdulillah, Dr. Zirak has given us some time this week as well to discuss this particular topic, because I specifically phoned up Dr. Saab and asked him to come for this specific topic, because it's a topic that I'm sure that Dr. Saab will highlight and tell us that it is the mental well-being of a person is something that plays a major role in regards to people committing suicide. Is that correct, Dr. Saab?
First of all, thank you very much for inviting me.
You can come every week, Dr. Saab.
It's always a pleasure. And alhamdulillah, it gives me a great joy that Madani Channel is always making an effort to focus not just on our physical health, not just on our spiritual health, but also our mental health. And overall, if you actually look at it, mental health is something that is a hidden problem. If you have a physical health, for example, you have an injury, you can see it. But mental health is hidden. From outside, the person may look completely normal, but inside they are in great pain. And obviously suicide, although it has got multiple factors, multiple reasons, but one of the biggest reason is that 90% of the people roughly who commit suicide, now all those people who commit suicide, 90% of them are associated with some sort of mental health problem. And basically one of the biggest mental health problem, which is very common, and we know it, is called depression.
Yeah. So
someone who suffers with depression, they are amongst the leading individuals who will actually end up committing suicide. And many of us, would have come across, if those viewers of Madani Channel, then this sentence that many of us would have come across suicidal thoughts. Thoughts that we want to end our life, thoughts that life is not worth living. Anyone who feels stressed in their life, and who is here who doesn't feel stressed? Those who feel stressed, but 1/3 of these people will actually have suicidal thoughts at some point in their life. Then obviously as the stress increases...
Are we talking about those people that everybody here could have these Okay, so it's a norm to have these feelings.
Exactly. So basically, most of us do have this feeling of stress. Now, stress is initial step that if it is not dealt with, it could lead to depression. So everyone has a normal stress, whether it is part of your work life, whether it is part of your family life, sometimes it could be children. So we do get this feeling of stress which is short-lived and goes away. But even when we are feeling this stress, then about 1/3 of those who are experiencing stress, they will have these suicidal thoughts. And obviously if the stress is not dealt with and they end up becoming depressed and the depressions are not treated, then, you know...
But there's certain people, Dr. Saab, that actually thrive on stress, don't they?
Basically, yeah. I mean, that is a normal part of life that most of us have this mechanism that we call as adrenaline rush.
Yeah.
When you are under a stressful situation, then you know, this adrenaline rush goes into your body and it actually helps you to perform.
Yeah.
This initial performance anxiety that when you know you have to perform in front of someone, that helps you to perform as well. But what happens is that, you know, stress in itself doesn't actually indicate that the person who experiences stress, how he's going to cope.
Yeah.
Now, how we cope with stress, I will cope differently with stress, you will cope differently with stress, Harun Bhai will cope differently with stress. Or sometimes what it happens is that in one situation I'm thriving on stress, but in another situation I'm not. Basically, whenever we face a difficult scenario, difficult situation, we assess it that do I have the resources to combat that particular situation. If I feel that I can tackle that situation, whether it is through my knowledge, whether it is through my experience, whether it is through other means, then no matter how difficult that situation is, I'm going to face it. I'm probably going to thrive on it. But if in my mind, I think that the demands of that job are greater than what I can deliver, or the resources that I have, then that stress is not someone I will thrive upon. So the difference between obviously each individual, what experiences they have, what skills they have to deal with the particular situation, is basically means that people can deal with stress better.
You mentioned at the beginning, though, that one of the major factors of people committing suicide is depression. Is stress, is the fact that, is stress the only thing that can lead to depression?
No, if we look at the depression has got a long list of factors that could actually, there are a number of different ways that we can classify. But basically, if I were to put it in a nutshell, my upbringing, my parents' upbringing, my family environment, my home environment, my school environment, and the experiences I have had throughout the life, whether they're positive experiences or negative experiences, whether I've experienced some form of abuse or not, these are all the factors that determine an individual's risk factors for developing stress, because life is challenging for everyone. It throws a number of different challenges. But those individuals who have had a balanced life, their parents have had a balanced life, they have had good sort of like loving and caring environment at home, these individuals will be much better off in terms of dealing with the stress, and they will be less prone to developing depression. And most commonly, obviously as part of our psychiatric assessment, when anyone comes, we ask them about what we call as their personal history. So we explore their childhood difficulties, if they've had any. For example, childhood difficulties could be at school where you've been actually bullied, or there could be difficulties at home if there has been sort of like parental relationship difficulties, or other financial difficulties and so forth. So there is a multiple risk factors that can actually lead to depression.
Depression is just one of those things that can bring about these suicidal thoughts, and we mentioned earlier on. But I think because you've touched on that, it's quite beneficial that maybe a lot of people are out there thinking, well, you know what, maybe I've got depression, maybe I haven't got depression. How can they, I'm just talking to you now, that how, to our viewers, how can you advise our viewers that if you feel, what sort of feelings do you need to have to make you think that maybe maybe I need to go and see the doctor. Or maybe before I go to see the doctor, I should do this. What, for those people that are out there, what advice would you give to them?
So basically, someone who has been having the following symptoms for more than about 2 weeks.
Okay.
So these are what we call as lack of interest. Something that was interesting to me is no longer interesting to me. It has now become a burden. Whether it is my work, whether it is my family, whether it is children, whether it is other colleagues. So interest, lack of interest is one of the root, or main symptoms of depression. But you have to have it going on.
Yeah, but I was just going to just to stop you there, because there's sometimes where, you get up in the morning and you think, I can't be bothered. I'm not interested in doing anything today. I just want to stay in bed all day. So, those people that are watching that get that, and they probably get that feeling every Saturday morning, to be honest. Or every Monday morning as well.
Well, or Sunday night.
So, I mean, again,
but that feeling goes away, doesn't it?
Yes, it does.
When you actually go to work, then it's gone. It's that initial. And I think, even children, when it is a Sunday and they start feeling, oh my God, it's Monday, I have to go to school. So many of them end up saying.
Yeah, so I mean, I don't want our viewers to all of a sudden think, I don't want to go work tomorrow, I must be depressed.
But anyway,
I'll go and see my doctor.
Exactly. So, but when you go to work, then it's all fine.
Okay.
If your children are saying, oh, I don't like school on Sunday, and then when they go to school on Monday, come back and ask them, they'll say, I enjoyed it.
They probably didn't enjoy it anyway, but it doesn't mean that they got depression.
Anyway, so basically, that's different. But what I'm saying is that it's persistent.
That's what I'm saying. There's a difference. I mean, you're using certain words here. I'm just picking these words. Sorry, Dr. Saab. That there's enjoyment. There are a lot of people that live their whole lives don't enjoy work. But that doesn't mean to say they're depressed, does it?
No, I mean, what happens is that if you look at it, the overall situation is that when you are at work, if you're not enjoying it in that sense, then you will end up making mistakes. And what would happen is it will start feeling like a burden. And every day this burden will be increasing, and it will begin to affect you mentally until you will basically not be able to cope. And your colleagues at work will notice it. Your family may notice it. It will display in the form of like frustration, getting upset and angry at little things, and so forth. So coming back to if we were to discuss these symptoms at that time, then obviously the whole silsila will go.
Yeah. Okay.
So one of obviously the first symptoms of depression, that is what we call as lack of interest. And the second most important one is low mood. Okay. So low mood means feeling unhappy all the time, persistently. And what happens is that in the morning, this tends to be worse. And as the day goes by, it does get easy. However, you still feel unhappy. So if this is normal, then in the morning, you will be feeling a lot more lower. As the day goes by, your mood does pick up. However, it doesn't reach the normal threshold. You are still quite low. So you're not happy. And for example, when you're talking to your children or when you're talking to your colleagues or other things, that your mood is low. And this is one of the things that patients generally say, that doctor, I don't feel happy, my mood is low. So that's the second symptom. You have to have these two symptoms for more than about 2 weeks. And then there are other associated symptoms. For example, lack of energy, feeling tired most of the time, inability to concentrate. So you can't concentrate. Your sort of attention span wanders. Why? Because you are thinking about lots of things in your mind. Some of the other things is that your sleep gets disturbed. So sometimes people may sort of end up sleeping too much, but most commonly people find it difficult to sleep. And this commonly presents as what we call as initial sleeping difficulty, that in the beginning they'll be turning and tossing in the bed for hours and hours. And then when they do fall asleep for a couple of hours, and then they wake up again, early hours of the morning. So when they wake up, and again there are these negative thoughts going on in their mind, and they find it difficult to sleep. And appetite most commonly goes down. You don't feel like eating, and it becomes a chore. So these are some of the symptoms, but what we call as you have to have low mood and you have to have lack of interest. And this tiredness, these three symptoms combined together, we call it core symptoms of depression. If you haven't got the two out of these three, then it is less likely that you got depression.
Okay.
You could have other problems.
So depression is something, we're going to carry on talking here, Arun, but just jump, just jump in whenever you feel like it, otherwise I'll just carry on with him. So depression is one, right? One, and before we move on to other factors that could possibly bring about these suicidal thoughts, a lot of people are very reluctant to go to the doctors. They're very reluctant to go onto medication because they're scared of what might happen. Well, what advice do we give to them people?
Well, I mean,
or is there is no other option? You have to go to the doctor.
I can understand their reaction that mostly people don't understand what is going on with them. And they feel that what a doctor is going to do. You know, it is because of this, it is because of this, it is because of this. And I can't sort these problems out.
And the doctor can't either.
And what the doctor is going to do. Now, basically, the depression, it has got what we call as some chemical basis. Our brain has got lots of different chemicals that it needs to work efficiently. And we call these neurotransmitters. It is basically how the brain cells communicate with each other. Well, there's a very intricate mechanism which I don't need to go into the detail.
Oh, thanks.
So these neurotransmitters, their levels, they drop.
Okay.
For whatever reason, their levels drop. When these levels actually drop, it is a bit like if I were to say someone has got anemia. What happens is the hemoglobin levels drop. They will feel tired. And this anemia isn't going to go away until you take either more iron supplements, whether in the form of vegetables or other things, or in terms of tablets. It's not going to go away. Similarly with depression. When you got these low levels of neurotransmitters, what especially we call this serotonin, this particular chemical. And doctors can sometimes, obviously, it depends upon the state of the individual, how severe the depression is, which is why it is important the doctor actually has an assessment. Sometimes it could be an underlying physical health problem that may be causing these symptoms of depression. And that is something that needs to be ruled out first by the doctor. So it may not be depression, it could be another physical health problem. Very commonly, thyroid problems can cause depressive symptoms. So the doctor will actually do this checkup, and let's say that if it is depression, then the doctor, in the case that if you got moderate to severe depression, then they will consider these medication. Now the medication, obviously what it does is that it raises the levels of serotonin in our brain. And when these levels of serotonin, they go up, we will automatically start feeling better. But it does take a couple of weeks. So generally, people are scared of taking the medication because there is this myth that you get addicted to antidepressants. There is this, and then what happens is when they start taking the medication, they want to see immediate result. You don't get the immediate result with antidepressants. It takes a time for the levels to build up, usually between 2 to 4 weeks. So people may not have that much patience.
I know I'm going to put you on the spot now, and you're going to probably kick me afterwards, but one thing is taking tablets, but what about, I mean, a lot of people, and especially in our culture, they'll look for, the desi ilaj, they look for the, those sort of cures, those sort of foods that they can eat, I mean, are there any, or have I put you on the spot here, Dr. Saab?
Now, basically, clearly, I mean, if I were to follow the medical guidelines, then I'm not the qualified individual to give any advice on that. But all I can say is that clearly the tablets, the medication that we have, it certainly does originate, in most cases, from these herbs. And I think, I mean, if I were to give that advice, some of the audiences may actually, act on that. So it wouldn't be very professional for me. But certainly, if anyone is interested or they want to try that, it is better to discuss with their doctor. In certain cases, there are certain sort of like natural remedies that may be available on the counter, but they are not effective for everyone. And you have to obviously bear in mind what other medication people are taking. What is more important is to discuss with your doctor that, doctor, I want to take this, or I'm thinking of taking this, and then the doctor can advise every individual on case-per-case basis.
So depression is something that can obviously affect all of us, and you would advise that those people that feel the symptoms of depression should at least go to the doctor. But again, there's this another underlying fear that people think that nowadays the doctors just hand out these tablets, as soon as you go there, just almost like a machine. So again, there's this fear. I mean, is that fear genuine, or should we put our faith in the doctors and get on these medicines? And is it something that if I take these medicines, am I going to be on them the rest of my life, or what?
I think before Dr. Sal answers that, I just want to kind of throw it a slightly different way, because the problem here now is, from many years ago, and Dr. Sal was obviously more experienced in this, is you had people with depression, but maybe 1 out of 10. With the fast life that we're living at the moment, with social media, with all the problems associated with it, and with all the vast things we're exposing ourselves to, our brains struggle to keep up. And so depression is now a common illness. And so if one patient came to a doctor and said, look, doctor, I've got this, and they'd go through their chart, and as doctors have us just analyze, they try and analyze their thoughts, and they'll say, but when you've got 10 walking in and every single one's, they eventually get to the stage where there may be, and I'm not going to kind of tarnish the whole profession, but it's easier to just write the prescription out for the antidepressants, because that's what they've come.
Well, that's what scares people though, doesn't it? That's the whole idea, that people are scared of that.
Basically, clearly, there are two professionals here now. We're talking about the psychiatrist, and we're talking about the GP.
Yeah.
Now, the psychiatrist field is completely different, because if a person is referred to a psychiatrist, then they will have at least 1 hour assessment window, half an hour, 40 minutes, where a doctor is going to take a proper detailed history and so forth, and analyze and everything, and that will actually restore the faith of a patient. But here in UK, you can't go and see a psychiatrist until your GP refers you. Now, when it comes to the GP practice, then as you know, that the GPs only have a 10-minute appointment. However, what you can do is that you can, when you book your appointment, you tell the receptionist that I wish to discuss a mental health disorder. And then now it takes longer. So they will book a double appointment for you. You will have 20 minutes. You can say this to the receptionist that I wish to discuss my mental health problem, and this is the first time. And this is what happens. Doctors who follow best protocols, if you go and see them first time, they will say, okay, I didn't know that you were coming with a mental health problem. We need to explore it a bit more. Can you go to the reception, book a double appointment, and I'll see you next week with a 20-minute slot, and we'll combine these together, and then we will discuss. Now, one of the things is that I can understand the GPs are under pressure, and I think you are right in the sense that quite easily GPs may prescribe, but they have their own reasons as well. Why? Because these, whenever a patient goes, there are these computer systems, okay? They analyze the statistics. Now the doctors are experienced, the GPs are experienced, they know half of the story you will tell them, and half of the story they look at you, and they will be able to diagnose. And you may not need to say too much before the doctor with his experience is able to make the diagnosis. Secondly, before you actually go to see the GP has got this long list of your record on their computer. They may even know which other individuals live in that address. They may have the information about the family, because that's what the GP is, as a family doctor. So they will have all these additional information. So if they were to say that here it is, try this medication, it is possibly that they are right in that decision. Yes, it is also a doctor's duty to explain to the patient, to satisfy the patient. Simply handing a prescription, the chances are that the patient will not take it. And there are many examples. that some of my family members came home and they took the doctor gave the prescription and they threw it in the bin. Why? I'm not going to take these medication because these are painkillers. How are they going to help me? And then obviously I had to explain to them, look, they are not just the painkillers, but they are also have this effect. And then they realized and they took them.
I'm just going to stop you for 1 second before you come in, Harun Bhai. I've got Hafiz Rafaq stood in the cold in Turkey here.
Very, very important topic that we're discussing. And I just wanted to mention a few of my own personal happenings where people have come, to me regarding the topic that we've got about suicide today. I don't want to mention the city, but there's been at least 2 suicides in that city. Now, both of them not related, but in a sense that why did these suicides happen is because one was a lot of peer pressure from school friends and all that, and the other was a lot of things that were happening at home. And this is really, really worrying because, because we've been part of the Tawizat Majlis. You get a lot of people that are coming that are worried, because of the financial situations at home, because of the fighting in house, husband and wife and all that kind of stuff. And sadly, what's happening is that a lot of people, because they don't have that knowledge of the deen itself, are relating to this suicide because they just want to get, rid of these things, or they just want to, basically, as they say that, once they die, that's his end of story. Halanki, it's not the end of the story. Allah Azza wa Jal, He mentions in the Quran, that do not put yourself into danger with your own hands. Now, sometimes what happens is we need to, talk about this, what happens in our own homes as well. There are an Islamic brother I know that is working, nearly a 17-hour shift just to, feed his family, but not only feed their desires as well. Now he's got a committee, a lot of families, they put committees in. Now the guy's got to pay £800 committee a week. Now for that, he's got to work nearly 16, 17 hours. And that is putting him to such a stress that I personally met the Islam brother, and it took me about a couple of hours just to convince him not to have these kind of thoughts. It was like the only way out for me is to commit suicide. And this is happening quite a lot in our own families today, sadly.
But what are the solutions, Hafiz? From your experience, what are the solutions?
Solution is ilm-e-deen, and the solution is that to be happy with what Allah Ta'ala has given you. Because a lot of the time, it's either you want to get married to someone, families are not, accepting, and then what happens is people go down that line. Or you're having to feed the desires of your family members. They want this, they want that, and the only thing that you think is suicide. So number one is most important is to learn the knowledge of the deen. Now, I think Nigran Shura and Amir al-Sunnat have mentioned this many times. How many ulama have you heard that have committed suicide? Rarely do you hear that. So one of the reasons is lack of knowledge. And we need to start to, alhamdulillah, educate ourselves in knowledge. And the other thing is that it doesn't matter if you can't afford what your neighbor has, what you have. If you are content, if you are happy with what Allah Ta'ala has given you, then alhamdulillah, be happy with that. Don't always think of the people who are below you, not above you.
Jazakallah, Hafiz.
So very interesting points there, Khalid. And I'm going to come back to something which Dr. Saab started with. And Dr. Saab was, mashallah, going through it. So I was just trying to I didn't want to interrupt his flow, mashallah, because obviously he's the expert in this area. And one of the things that Dr. Saab hinted towards was that when a person has a difficulty, and we're all made for difficulty, this life is there to see how you cope with difficulty. So when he has a difficulty, he looks at his own resources and he thinks, can I solve this problem from my knowledge, from my skill, from my experience? And he thinks no. And then what he does is he looks at his slightly wider circles. He looks at his brothers, sisters, family members, and he thinks, well, they can't help me. Or he goes to them and they don't help, or they can't help. So he looks further afield. He tries to see if I've got any friends in positions of influence. And when that doesn't work, he hits a dead end. But that's where the problem is. He hasn't hit a dead end, actually. This is the beginning. Why? Because what we should have done is we should have turned to Allah Azza wa Jal in the first place. Don't look at your own skill. Have I got the skill to deal with this? Have I got the money to deal with this? No. And the fundamental root cause of the problem was that right from the beginning, you were looking for the solution in the wrong place. So you looked within yourself, you couldn't find it. You looked at the relatives around you, you couldn't find it. Then you looked further afield, you couldn't find it. And then when you hit a dead end, you think, I've got nowhere to go now. And the lucky ones at that stage, they get the thought, it comes back to them and say, but Allah Azza wa Jalla is there to help me. And those people are not the ones who get the suicidal thoughts. The ones who get the suicidal thoughts are the ones who hit that dead end. Now there's different categories. Dr. Saab obviously knows, and there's different types of people. Some are narrow-minded, so they'll have one problem. That problem is now the end of everything, and they will ignore all the blessings of Allah Azza wa Jalla that they have, and they'll just concentrate on that for that moment. It's like an angry person. They can't see, their judgment is clouded. There was a famous waqia in one of Nigrani Shura's bayans, and he said there was a king, and he said to one of his wise men, he said, can you write me down something that when I read, if I'm upset, it'll make me happy, and if I read it when I'm happy, it will calm me down. So this wise man, and he really was a wise man, he wrote something down, and whenever the king was happy and ecstatic, he used to read it and it calmed him down. Whenever he was upset, something had gone wrong or, some difficulty, he used to read it and he used to say, thank Allah Azza wa Jal, and he used to get over it, and he used to and what was written on that piece of paper was simply this: this time will pass.
Allahu Akbar.
That's it. And what we do is we isolate that time capsule and we think, right, this is the end of our lives. What we ignore is all the brilliant blessings that Allah Azza wa Jalla has given us for the last 30 years, all the brilliant blessings that are surrounding us now, everything that awaits us. We take one tragedy, Dr. Saab, from the past, and then we replay it in our mind, so much so that our beautiful garden that we've got before us, in our eyes, becomes a desert. And we kind of develop this mental state where we think, I've got nothing. And what Hafiz Sahib said was a very beautiful Madani pearl. He said, look, we look the wrong way. We look at the people who are better than us. And if you were to sit down, if anybody's depressed, one of the best things they can do, and I'm sure this is in your books as well, take them to places like Africa. Let them do a round of people with real problems. And then they'll realize, they'll come back and they'll be thanking Allah Azza wa Jal, and they'll probably never miss a salah because they appreciate the blessings of Allah Azza wa Jal. And a lot of these tragedies are brooding over the past or anxiety over the future. Well, the past has happened, and whatever Allah Azza wa Jal ordained is what happened. The future is whatever Allah Azza wa Jal will ordain. Your job is to do the best you can. You don't decide the results. And again, it goes back to what Hafiz Sahib said. It's knowledge. It's learning. And what we do is we get locked into this worldly fast life. We don't go to the masajid. That's a cure for depression. We don't recite the Quran. That's a cure for depression. We don't recite Durud Pak. You can guarantee that, you've got 1460 years of Islamic history, Khalid Bhai, where the cure for depression is Durud Pak. And yet, when was the last time that when we had, that sort of difficulty, we turned to Durud? And this is the difficulty. And there's a beautiful analogy, Dr. Saab. Life. When you buy something from a shop, you bring it home, you plug it in, you try to make it work. Khalid Bhai, doesn't work. So what do? You play with the switches, you play with the wires, and you might electrocute yourself. Nothing's working. So eventually you give up and you sit back. And you think, it's not working, I've tried everything, and you're stressed. And life's like that as well. You've tried to make life work, it hasn't worked out for you, so you become depressed. Yeah? The problem is, with the thing that you bought, if you look in the box, there's a manual. Go back and read the manual. And you read the manual, you think, this is very easy, I can make this work. You flick the switches, you set all the settings, beautiful, you're benefiting from it. What did you do? You read the manual. In exactly the same way, that's what you're doing with life. You're trying to make life work without the manual of life, which is the Quran and the Sunnah of Rasulullah. That's why you're getting into problems. If you take the manual, you won't get into problems. If you try to build your life according to your intellect and your upbringing, which you mentioned, you'll always fall into difficulty. Why? Because you weren't designed for that. Your life was designed as a test, and the only way you can get through that test is if you live it in accordance with the teachings of the Quran and the Hadith. And there's no other way. If there was, people would have been successful, and the only ones who have been successful in this battle. And if you look at the utopia of Islamic society, those days when, alhamdulillah, Rabbil Alameen, the people had the true understanding of Islam, you didn't have depression. You had very little, and those who did, they were in extreme situations, and it happened for extreme reasons. I think there was a hadith Mubarakah in the beautiful booklet that Amir al-Sunnah Barakatum al-Aliyah has given us in relation to suicide and how it's haram. And in that, there was one of the people at the time in Nabi Kareem Sallallahu Alaihi Wasallam who was in pain so much because of some war wounds that he committed suicide. But look at the extreme situation that he was in. Today, what do we have? We have youngsters who, just because parents have said something, that's it. We had one young daughter, Khalid Bhai, in a town not far from here, who was bullied at school, and she didn't know what to do. She didn't tell her parents, she didn't tell her teachers. She just came back to her room. Yeah. And this is the difficulty. And the other thing is, as our children grow up, if you were to say to your child, Dr. Saab, as they're growing up, 7, 8, 9, 10, I've got this difficulty. And he said, go recite Durood Sharif, your difficulty will disappear. Okay, let's sit down and read the Quran. Better, let's do dua. Let's do dua, and your difficulty. What does that child learn? Does he learn or she learn that, well, every time there's a difficulty, all my parents seem to do is shout and scream at the top of their voice, lose their temper, don't know what to do, break things, and that's the end of everything? Or do they say, no, it's time for Salah. Let's put down the prayer mat and let's pray in the court of Allah Azza wa Jal. Why? Because Allah Azza wa Jal is the solver of all problems. And that's the mentality that we need to teach our children.
I think quite a few things you touched upon the Harun Bhai. But one of the things that you mentioned, the example of the girl that got bullied and she came home. Statistics have shown that only 27% of those people that committed suicide have actually talked to the mental health services. A lot of people, because they don't communicate with other people, they don't talk to other people and try and resolve the issue, then they get these suicidal thoughts. But from what Dr. Saab said, there's one side of it, Harun Bhai, which I agree with you, that there's the side where, yes, we need to be more thankful, we need to be more shukr. But then at the other side, we have to realize that people have these mental health problems as well. And you mentioned depression, but another one of the major areas that I've heard, and I'd like you to talk about briefly, is psychotic problems. Apparently, they are the ones that, I'm not going to say, you can explain what kind of these problems are.
Two things I'd like to just touch upon from what Harun Bhai said is obviously, there will be many people sitting out there when we are saying you're thinking negatively, and they will feel you're not sympathizing with me.
Yeah.
Now, these people, their brains have been conditioned to think negatively. And why their brains have been conditioned to think negatively is what Harun Bhai was saying, is that if parents shout at the children all the time there's a problem, then what their brain gets conditioned to is, okay, if I have a problem and if I tell someone, I'll get shouted at. And once this mechanism is fixed in our brain, then it sticks with us for the rest of our life. Allah. And I think this is where obviously I would, basically in terms of the religious knowledge. Now, there are many aspects of religious knowledge which are protective against suicide. One of these things, if we were to, for example, look at these, as I was talking about the depression, and I said childhood difficulties. So if parents have been shouting at that child, then his brain gets conditioned not to share the problem and to think negatively. And also they have negative experiences, which again conditions their brain to think negatively all the time. And they are powerless to think positively. And one of the obviously way you said was that show them the more difficulties and then they will begin to appreciate. And that's one of the ways as well. Now, this was obviously talking about the religious side of the things, that how can religion help with you. If the parents have a positive behavior, parents are well educated in terms of the beautiful teachings of Islam, then they will very well understand. And Alhamdulillah Azza wa Jal, if we were to, I have, since I've been part of Dawat Islami, through the promotion of Amir al-Sunnah, I have read many books, and especially in our Madani environment, we've got Madani Inamat. And one of the Madani Inam is, have you read Minhajul Abidin, written by Imam Ghazali rahmatullah alayh? He was a philosopher of his time, and someone who has got psychiatry knowledge, someone who's got philosophy knowledge, and who, if they were to read his books, it will very openly display the knowledge of Imam Ghazali. And if you read Ihya ul-Ulum, if you read Minhajul Abidin, from my point of view, this is the best psychological therapies that you can ever get.
It changes your life.
So anyway, so coming back to your obviously question about psychotic disorders. So basically, when we talk about mental health problems, depression is something which is much more common, and people may not actually be able to see that this is a depressed person, because you can very easily hide these feelings. But when someone is psychotic, this is what we think generally, that someone is mental or pagal hai. Now this person who's got a psychotic disorder, so there are a number of different types. One of the common ones is schizophrenia. So these are psychotic disorder. Again, this is a different type of imbalance in the neurotransmitters in the brain. And again, this also depends upon these negative views about an individual and how you perceive a particular situation, and you end up thinking negatively, and it actually causes a psychotic disorder. So someone who's got psychotic disorder, they will have two main
hold on,
things.
just to stop you there. So these disorders can be brought upon on how you think as well?
Exactly.
Okay.
And
So it's not just like another illness where you can just have a naturally occurring illness. It's something that can be brought upon by your own actions.
Most of the mental health problems, they are a combination of your physical environment
Okay.
that you have experienced and how that has affected your mental thinking abilities. And basically, it is very easy to demonstrate that many times, for example, let's say I was coming to this silsila, and there are two thoughts that are coming in my mind. This is just an example.
Go on.
Will
I'm
there
intrigued.
be technical difficulties or not?
Okay.
And will we go live or not?
Okay.
And the other thing is, yes, everything will be fine and we'll go live.
A positive.
A positive thought and a
Yeah,
negative
a negative thought.
Now, if I'm just focusing on, oh, pehle bhi aise hi hua tha, itni dafa gaya hoon, to ye,
It's
to
not going to
wo,
happen.
to
It's not going to happen.
How am I going to feel?
Yeah.
If at that time someone calls me to discuss something, I'm only going to take negative things from his conversation as well. And then afterwards, I'm only going to think about the negative interpretations from that.
Just on that, Khalid, you're the expert in this, but if you did that, wouldn't that automatically release the wrong sort of neurotransmitters in your brain so that your whole body's affected by that negativity?
Now, basically, at the moment, I'm not exactly sure, but once you are thinking negatively, because our thoughts, they affect our behavior. So what we call as cognitive behavior techniques,
Yeah.
CBT. Our thoughts affect our behavior. Now, if I'm thinking negatively, I'm going to feel angry, isn't it? When I'm feeling angry, my body releases adrenaline or other these hormones, my blood pressure goes up, and if I constantly remain in that negative frame of mind, it's going to affect me physically as well, but at the same time, I'm going to perceive. Then what happens next stage? I'm going to perceive everything negative. Then what happens the next stage of it is, someone said something and you took the negative, which was valid. Now you will, without actually someone saying something, you will think about something in the past and start creating these negative images in your own mind.
But Dr. Saab, you know, you talk about negative and positive here. There are a lot of people that are pessimistic and they say, well, don't expect anything. So when something good happens, you're happy. You know, for example, I'll take your example. It's always technical problems. It's always technical problems. It's always technical problems. When you go, oh, it's working, brilliant. And you're so happy about it, right? Rather than being the other side where you're always positive about it. And then when you come here, you're sad because it's not happened. So there's a flip side of it as well, isn't there?
No,
You see, that's interesting. Doctor, what do you think of this, though? You know, no matter what it is, whether it's positive or negative, it's not the fact that you're expecting something or not. It's those background thoughts that keep going. And those are the ones that are going to control your life. So if you can rein your thoughts in, so if you control, see, you're the experts in this. This is why I'm kind of smiling as I'm going along, because basically if you can rein your thoughts in so that you try and control them, and it's an art. You have to try and do it, and we all have to try and do it, or else, because what you've got to bring into this equation is the shaitan. Because that's what he does. You know, you mentioned the psychotic people. Those are extreme examples. Normal run-of-the-mill, what you have is the waswasas of the shaitan coming in and then confusing you, giving you the negative thoughts, and you then going along with those negative thoughts and looking at all the dire consequences, and he makes you regret the fact that you're even born, and that then leads to the fact that you want to commit suicide. But whereas, if you counter it by saying, okay, like you said, your example, okay, I'm going to the studio. Will it work or will it not? Well, if it works, it works. If it doesn't, it doesn't. But I've come all that way from Leicester for the sake of Allah. If it doesn't work, it's even better. I can get back home early and I get the sawab.
What you are doing and what Khalid Bhai said, you are conditioning your thoughts to be positive.
Yes.
But someone who's got mental health problem, they cannot condition.
Okay.
Their thoughts have already been conditioned.
Okay.
Now, what I was going to say is that now I'm trying to describe to the audience step by step that what is psychosis. Now, continuously thinking negatively, and then something happened and you thought negative, and then the next step is something doesn't happen, you start thinking negatively, and then you end up believing in these things which are not true. So when you believe in something which isn't true, we call it as a delusion.
Yeah.
In the sort of talk of psychiatry, delusion is one symptom of psychosis, and this is where someone who's talking there with all that thinking, they will say something about you, and which you will say this is absolutely not true. Not just about you, even if they were to say the same thing about you to someone else, they will say this is not true, this is not fact, but they are convinced it is fact. Why they are convinced? Because of their negative thought patterns. This is one symptom of psychosis. The second symptom of psychosis is again, in a layman's term, when you keep thinking about something, you may start hearing things. You may start seeing things. But most commonly in a psychotic disorder, when you are thinking about negatively, let's say for example, you're saying my neighbor may be plotting against me, because this is a negative thought. And then you will start hearing the voices. It's actually inside your brain that you've been thinking so intensely about these things that now your brain's creating this experience for you, which is real for you. And you will actually not actually budge from that idea. These will then appear as voices, what we call as hallucinations. It's basically the stimulus is not there, that external voice is not there, but because you've been thinking about it, and in your mind has now created this voice, and you become convinced, no, he said it. He may not even have been there.
But that particular example is for your extremes. What you get in run-of-the-mill, Dr. Saab, is this, that anything negative, you will have a thought about it. That thought, what the waswasa, the shaitan and the nafs will do, they will repeat it in your mind again and again. Now, when it first starts, if you do something about it, if you challenge it with something positive, or you read A'udhu billahi minash shaitanir rajim, or Qul a'udhu bi rabbil falaq, Qul a'udhu bi rabbin nas, it will counter that. But if you allow that thought to repeat again and again, and this is how the mind works, doesn't it? From different angles, and it'll plug all the gaps and it'll make almost a picture of it. Then it goes from a mere thought to a concept. So now this is taking over. And if you allow that to grow, it doesn't happen overnight. It gradually grows and grows and grows. And what we've done is we've allowed it to grow not just a concept, it's now become part of our life. So what happened is that, for example, the example you had, I saw my neighbor, he was looking towards my house with one of those looks, and I thought maybe he's plotting something, to now, 100%, he's ready to attack my house and he's ready to burn it down. And there's no, if you look at evidentially what's there was nothing, but our mind has made it up. Now, if as soon as you saw that, you said, A, I'm probably got it wrong, husn zan. B, even if he is, there's not much he can do, and that's it, I'll ignore it till it happens. But you've allowed it to grow. And if you allow it to grow, it gets to such a stage where it takes over your life. And then, if you come in as a doctor and you say, well, come on, that isn't going to happen. You say, why? It's possible. Why isn't it possible? He's like this, he's like that. And what the shaitan has done is taken one little incident and he's opened up, not only corrupted your mind, it's like a virus, isn't it? Put a virus in your mind that is in your thought process, and at the same time he's opened the door to Jude, Ghibat, lying, backbiting and everything else. So it's a full plan of, sins from that one little process. And isn't that what is in the vast majority of people? That's what the concept
Well,
is?
basically, yeah. I mean, there is this concept in books. It's a very fundamental concept. Is that all the time our brain has got negative thoughts. What we call as automatic negative thoughts. So a thought comes, it goes, comes, goes, comes, goes. And majority of these thoughts are negative. And this could be from shaitan as well. Now, if you then, based on your life experiences, some of these thoughts you'll not let them fix in your mind. But some, based on your experience, you will accept those thoughts. Then these thoughts that you accepted and they have actually tied in with your experience, then these will, what we call as, become your core beliefs. Now, what I was mentioning about Imam Ghazali rahmatullah ta'ala alayh and the religious knowledge, and in Minhajul Abidin, I think it is chapter number 3 of it, where Imam Ghazali rahmatullah alayh actually goes into and explores the origin of thoughts in our mind. And he actually, obviously, ultimately, everything is associated with Allah Azza wa Jal, in that sense that he is the creator of everything. But metaphorically speaking, or majazi taur par, the thoughts are attributed to the shaitan, to our nafs, to this farishta called mulhim, because it's what is called ilham. So angel actually puts these thoughts on the order of Allah Azza wa Jal, and then Allah Azza wa Jal himself actually puts thoughts in your mind as well. Now, where you were coming from is that if we have a religious knowledge, and our upbringing from childhood was this by the parents, that beta, look, this is the origin of the thoughts. We need to, now Imam Ghazali obviously then further explains that how can we judge which thought is good and which is bad, and which good thought has been put in our mind by shaitan to lead to a bigger negative consequence. And he mentions this obviously, and then if parents knew about this, they can tell their children about this, and the children can then obviously, with the help of this knowledge, and all of us can condition our thinking and get rid of these negative core beliefs. Now, you've noted, and I've seen it as well, there are two types of people. Either you are from the beginning attached with the religious environment, or you are not. If you're not attached with the religious environment from the beginning, then somewhere in your life, something really negative happens, and you turn to religion. When you turn to religion, you see these people changing.
Yeah.
Why do they change? Because now they're gaining this religious knowledge, and they're able to change their negative thoughts themselves, and they begin to condition their own thoughts with the help of this knowledge. And alhamdulillah, with the blessing of this, they then become happy. So overall, I mean, I don't know what time it is.
Carry on.
But we are talking about the suicide, and obviously if I were to put a lot of things together, obviously this silsila is only for 2 hours. But from a professional who obviously knows, alhamdulillah, through the Madani environment of Dawat Islami, a little bit about Islam as well. To be honest, if I can say this, I haven't got any evidence to prove myself right, and no one has got the evidence to prove me wrong either, that if we begin to understand the teachings of Islam properly, and we begin to act upon it, there is no other better therapy in the mental health world than this. Acquiring religious knowledge and then changing your own views. this is the most powerful therapy. And the Madani environment of Dawat Islami, in the previous silsilas that have happened on Madani Channel, I've always touched upon this topic. Government in UK, mental health services in UK, because what happens then, when you have these negative thoughts, you then become scared of the world outside. So you cage yourself in, either physically in your own home or mentally in your own thoughts by not interacting with others. You may be out and about, but you're not interacting. You are just in your own world. And what the mental health services are doing is that they are spending a lot of money on what they are calling it as a community engagement, social engagement. Mental health professionals, mental health nurses, they are going into these people who suffer from mental health problems on a weekly basis, taking them out to socialize with others in all different forms and shapes. You can carry on from there.
It's beautiful you say that, though, because that's what the environment of Dawat Islami does.
Exactly.
And it does it in a very subtle way, because what you have, Dr. Saab, in reality is a lack of understanding as a child to deal with your problems. Now, a lot of people might think, well, they keep mentioning that. What do I do if that's happened? Well, you can break the chain. What you have to do, you have to change your environment. And you can't just do it overnight, and you can't just do it by yourself, because you're ingrained in this system. So you have to change your environment. You have to change your friends. You have to change what you watch. You have to change what you do. Now, what Dawat Islami does, and Amir al-Sunnah Dawat Barakatum al-Aliyah has done, is giving you a viable alternative, and it's not just one shop. This is the beauty of the environment of Dawat Islami. You attend the Thursdays to the Mass. You attend 3 nights a week to Madrasa al-Madina Baligan with just before Isha, Salah after Maghrib. Then you travel once a month on the Madani Kafilas. Every night you sit down and you do a self-analysis with the Madani Nawat card. On Sundays you watch Saturdays you watch the Madani Mazakra. On Sundays you watch Tonight with Madani Channel. These things, what they'll do is when you travel on the Madani Kafilas, when you do all these things, they change your environment. And what do? They put you in touch with people who have an understanding of the Islamic concepts, but B, more importantly, they have that love and affection. And it's that love and affection, you know better than I do, that can change the mental thought process. Over to you.
I'll give one example. And once there was a patient I was seeing in the clinic, and he obviously had mental health difficulties. And he used to be really fed up every time I used to see him. And then one appointment he comes and he was very happy. And he was ecstatic. And he couldn't control his joy. And he said, "Doctor, I felt so good." I said, "What happened?" He goes, "I had a heart attack. And I was in hospital." And I was thinking, obviously, that you have had a heart attack. You were in hospital. And you are telling me that you felt so happy. Now, why did he feel happy? He was looked after in hospital. He was treated nicely in hospital. He was given respect in hospital. Someone was there to serve him food. Someone was there to answer his question and care for him. Now, Dawat Islami is a hospital.
Subhanallah.
You come weekly ijtima, or you come, people, how do they treat you? They hug you, they smile at you, they give you respect. And many of these people, unfortunately, they don't get the respect from their family, from their peers, from other people. And for example, if you are sitting down in the Madani environment of Dawat Islami, and we've seen it on Madani Channel as well, that Islamic brothers will actually serve the food themselves. Amiri al-Sunnah will do it, Nigran Shura will do it. And this is the tarbiyat of Dawat Islami, that you display good manners, good etiquettes. And you ask them, you may ring them, and simply, just like that patient who got a heart attack and was looked after and made him feel so happy and good about him, similarly, when you come in Dawat Islami Madani environment, this is what you see. Islamic brothers are actually affectionate towards you. They are not judging you. And the other thing is, because when you are in this environment, people don't know you at a personal level. They don't know about your problems, so you feel comfortable. Because if you go to a family gathering, everyone knows about your problem, and again you are in a negative thought. What if he asks me this? What if he asks me that? What if he asks
He
me
knows
what
this.
you're doing?
He knows.
He knows this. I'm not working. What if they ask me about a job, and so on and so forth? And as a this is a point of reflection for everyone, that many times we inadvertently say things without thinking that can be, especially for people who are suffering from mental illnesses, mental health problems, for them it could be like a mountain crushing them.
And this is the
Just a
beauty
simple
of
question.
Islam. Character is emphasized so much, and mercy towards others, because you don't know what mental state the other person is going through. You may just pass a comment without really thinking that it's that harsh. But
Something very simple, Mazra, sorry to cut you in there.
I'm just listening to you.
Is
too,
that
don't worry.
before you say something, get to know someone. Don't just end up asking a question. Pehle sune. First listen to them. And they will be telling you a lot of things and so on and so forth. There are lots of general questions that everyone can ask. But certainly, even within Dawat Islami, we got to be very careful, because I've come across these situations where, alhamdulillah, with all muballighins of Dawat Islami, people trust them and they discuss their personal problems.
Just come back, to bring it back, because obviously we're talking about suicide at the moment, and there are many other factors that I want to basically discuss. But the two things that we discussed so far are those that are mental health issues, i.e. depression and psychotic thoughts. And obviously, as viewers that are out there that maybe feel that they are suffering from depression, maybe there are people out there that feel, or they have been diagnosed with psychotic illnesses. Are they inevitably, now we're putting the fear in them that, you're going to be thinking about suicide tomorrow? Is this something that they're going to go to, or is it a necessary path that they're going to go down?
Before Dr. Sarkis, I'm going to try and answer that, because basically we're talking about people who are stuck in this vicious cycle.
Yeah.
And the first thing is that if somebody around you is, one of the best things that the best of creation, sallallahu alaihi wasallam, has taught us is listen to people. A lot of times we don't spend time listening to people. They want to, reveal everything. They want to talk to somebody. And there was that famous narration about a elderly Mai in Medina Park, and she wanted to speak, and the Sahaba Ikram said, Ya Rasulullah sallallahu alaihi wasallam, she will talk for ages. And she sat the best of creation in the sun, talking about her problems. And Nabi Kareem sallallahu alaihi wasallam, afterwards when that was said, Nabi Kareem sallallahu alaihi wasallam said, nobody listens to her. If I don't listen to her, where's she going to go? And this is how the beauty of Islam is. And the other thing is this, and it's going back to what Dr. Saab said, and it ties into your question. There was a man, and I was reading this book, and it was really interesting. There's a man who, busy with life, running about all the stress, anxiety and everything else, and doctors tell him, we've done your tests, and this is a true story. And they said, you've got this illness, and you've only got months to live. And he thought, forget it. If I've only got months to live, what use is all this that I'm doing, this businesses and everything else? Forget it. I'm just going to go and enjoy life now. I'm not going to let anything stress me out. I'm going to think positive. I'm going to go, I'm going to tour the world, I'm going to enjoy life. Yeah? He does that, comes back, and he's still alive. He didn't pass away. His illness, he was cured with as well. Because of his mental state, the medication helped as well. Now, the question you asked is, what about those people who are in this vicious cycle? Well, what I would say is this. You've tried everything else. Try coming close to Allah and His beloved Habib sallallahu alaihi wasallam. And the question may be, well, how can I do that? And I can give you, sat in your home, a half a cure. I call it half a cure because the rest is you implementing it. Start watching Madani Channel day and night. That will start to cure your illness. Attend the Thursday Ijtimas and the Madani Muzakaras and the Madani Kaflas, and within a few months, if your depression doesn't disappear, and then for the sisters, there are sisters Ijtimas as well, and they watch Madani Channel at home as well, and that will, and the sisters classes, go and learn the Quran. Watch how it disappears. And for the brothers, Dr. I have a solution which a lot of people have come back and said that it really works. It's a treatment that is so effective that it's unbelievable. And the Buzurgan-e-Din have written it time and time again. If you can pray as many salahs with jama'at in the masjid as you can, but even if you can't get there during the day, you're at work, make sure you pray your fajr and your Isha in the mosque with Jama'at, right? And make sure you recite at least, even if it's 5 minutes of the Quran, 3 ayats with tarjuma and tafsir, with translation and commentary every day. Just that, nothing else. Obviously protect your 5 prayers, Zohar, Asr, Maghrib, because for this to be effective, you have to do that. But do that, and if your depression doesn't disappear within a short time, then come back to us. Come back to Dr. Saab.
So basically, the Khalid Bhai's question was that those individuals who may be suffering with depression or psychosis, and does it mean that they're going to commit suicide? Now, a very simple answer to that is that if they've not committed suicide or they've not tried to, the biggest chances are they will not do it as well. So if your previous behavior predicts your future, so if you've not actually acted upon your thoughts, suicidal thoughts, then the chances are that in the future...
But I've read reports where people that they've had these, not suicidal thoughts, but self-harm. And that self-harm has led them to that stage. It's like on a stepping stone.
Yeah. So the next thing that I was going to say is that out of these individuals who suffer from let's say mental health problems, there are certain risk factors which increase the chances of someone committing suicide. So if I were to talk about hopelessness about future, is one of the big ones.
Yeah.
Second one is guilty.
Yeah.
You blame yourself.
Yeah.
So these, if any, because doctors will generally ask about these questions specifically. That,
Guilt and shame.
Yeah, guilt and shame. Shame is another thing, but guilt and shame, and obviously hopelessness.
Yeah.
So hopelessness and guilty, when a doctor asks about these things, because doctors have got these skills to, even the patient wouldn't open up. So we then sort of use these keys to open this lock and that lock and that lock and that lock, and eventually everything spills out. So ask them about, do you feel hopeless about the future? You say yes. And you say, do you actually blame yourself for this situation that you're in? Say yes. And this is, I'm actually educating the public here.
You're educating me as well.
They can ask these questions. Then you ask them, do you think that life is worth living? You know, this is a very open-ended question. You're not putting any things in their mind. Do you think life is worth living? They may say, I don't think life is worth living. Now you go to the next question. Okay, do you ever think that I should be better off dead? Now let's assume that they will say yes. Okay, so tell me what thoughts you've been having. They will tell one. Okay, any other thoughts? They'll tell second. Keep on saying any other thought. They'll tell you third. In between, you sometimes repeat what they've said so that they know that you are listening. You need to keep the body language interesting so that they know you're listening. You sympathize with them as well. And they will tell 3-4 different thoughts. Now the next step is you've identified they've got the thoughts. Okay, have you actually made any plans? Because thought doesn't mean you're going to kill yourself. Now you need to make a plan to put that thought into practice. Now this is a very crucial question. They may not be at the stage of planning as yet. If they say, I've not planned anything.
You mean generally plan for the future? You talk.
No. Planning to end their life.
Okay.
By acting on these suicidal thoughts.
Okay.
Now they may say, no, I haven't made a plan. Then you say, okay, so what is stopping you from putting these thoughts into planning stage? This is what we call as protective factors. Whatever they say is my family, is my mom, is my dad, is my children, it's what the family will say, or many times Muslims do say, my religion stops me from this. This is what we call as protective factors. Now, as long as these protective factors will remain there, you can be pretty confident that they will not put their thoughts into planning stage. And as a doctor or as a family members, let's say that this individual was saying that it is my mom that is stopping me from acting on my thoughts, and Allah's will that his mom dies. Situation's changed now.
Yeah.
That protective factor's gone.
Yeah.
Now, as a family member, I need to now pay more attention to him. This individual may now, whatever that protective factor was, once that's gone, now you need to reassess the situation. And let's say that now they said, okay, now I'm planning. Then you ask them about the plan. Now this is where then things become more complicated. And the more you ask, sometimes people fear that if I ask about suicidal thoughts, I will actually make them commit suicide. Now this used to be the thinking in the psychiatry profession,
I was going to say actually,
in the past, but not anymore. You cannot actually increase the risk of suicide simply by asking someone about it. You will increase the chances of that individual discussing this with you, and then you can increase the chances of helping them.
but Doctor, you're talking now about those people that are willing to talk to you, right? The example that Harun Bhai gave earlier on of a sister that she was bullied at school and came home and committed suicide, that was because she didn't talk to someone. If you've got an environment at home with abusive parents, if you are in a state where you are feeling lonely, if you're in a state where you're feeling that you are not successful, if you're in a state where you feel that, you know, whatever's happening is because of me, you know, I'm the problem here. You know, if it wasn't for me, then everybody would be happy. If it wasn't me, and these people aren't talking. You know, I think like I said earlier on, you know, it's only a quarter of those people that talk to people actually commit suicide. It's the other 75% that don't talk to people. You know, and another thing is Dr. I'm throwing a lot at you because there's a lot of people out there that they feel that, you know what, if I do talk to a psychiatrist or I do talk to the doctor, he's going to like sanction me. Yeah? And there's that fear.
Yeah. So first of all, very important question that you asked. Those who don't talk, and there is a vast majority who don't talk, the responsibility is upon, let's say that these are, we pick up that these are school year children, like he said that you know, a child got bullied.
That was just one example, wasn't it?
So
There's
let's
lots
say,
like that.
you know, a teenager who's going to school and he's experiencing difficulty. And he's
I
not
mean,
talking.
a teenager should feel that, you know, I'm not fitting in with the crowd. A teenager could feel that, you know, he feels, oh, I'm ugly and nobody likes me. A teenager could feel that he's been picked on, he's been bullied on, or he feels that because he is having these thoughts in his mind about his sexual orientation. There's all these things that can happen in a young child's mind, which can bring about this.
Yeah, so basically in this particular situation, now the responsibility shifts towards what we call as guardians or caregivers. Now this is a very wide term, caregivers. Caregivers are many in the society. It's parents, immediate family members, teachers at school. They are responsible according to the law of the land.
Corporate parents, yes.
The medical professional.
Yeah.
This individual will actually try to knock on some of these doors, but that individual, if he's not alert, he may not pay attention. And if you ask those individuals who have committed or were very close to committing suicide, majority of them do try to open up, but the door that they knock doesn't open. Parents, now these things don't happen overnight.
Yeah.
Bullying doesn't make you commit suicide there and then. Even in that example that Harun Bhai said, yes, we've seen the end result,
Yeah,
but they may have been going on for months or years.
Yes.
And in that time period, now obviously I'm trained in mental health, and I could say this, that there were many signs where someone could have stepped in. Now it turns out to be better education of both the public, parents. Even in medical professionals, there is more training needed of mental health professionals as well, and training in school, which is where the government is actually, or the education authorities here in UK are putting huge emphasis on safeguarding. And safeguarding is at the moment is the hot topic.
It is the topic.
Dawat Islami as well.
Yeah, it's
and
the topic.
Quite rightly. And so far, alhamdulillah, I have not come across a principle of safeguarding which goes against the teachings of Islam.
Yeah.
If anything, teachings of Islam should have actually prevented this from happening in the first place. But anyway, this is where, you know, lots of parents, family members, friends, school teachers, medical professionals, 4 or 5 that I can name, that should have been able to pick up these symptoms. And it is not their fault either.
I mean, you mentioned then that there's these things that can happen and they take time, like the bullying can take 6 months, 12 months, whatever. There's also, you know, people have been known to commit suicide because they failed their exams. You know, the expectations that are put upon them by their family, the expectations that are put upon them by their teachers. And when they don't fulfill them expectations, then again, this huge burden of failure, and in some cases shame, that they feel that they can't show themselves in front of the families because they've not got the results that everybody expected them to get. They've not done what everybody expected them to get. They've not achieved what other people have expected to. And that carries on from a school age to later on in life, where the expectations on family members is where you've got 3 people that have 3 brothers that have got a really good career and a really good job and a really good house and everything, whereas the other one hasn't. And all these factors, though, can...
Yeah, clearly. I mean, there was a silsila about this on Madani Channel with Nigrani Shura, where he talked about obviously students committing suicide, and you know, there are 2 things mentioned. One was perceived failure.
Yeah.
You were 80%, but because you couldn't get into medicine, because you couldn't get into law degree, because you couldn't get into chartered accountancy, but you still feel as a failure. 80%, 70%, it's a perceived failure, and this is where the parents actually lead their children into these perceived failure. And the second thing that you said was about the shame. This is where the shame, that what by bradri ko kya muh dikhayenge, what face will I show to the community?
Yeah.
But isn't it lack of Islamic understanding as well? Because if, as parents, we believe and we show our children the fact that if you tried your best, you've given it 100%, and the result hasn't worked out, that is the will of Allah.
No, but Harun, you're right. I mean, I always said to my daughter that if you try your best and you fail, I'll be happy. If you don't try your best and you get 100%, then don't expect any praise from me. But still, because...
I'd take the latter any day.
No, but because, the thing is because the peer pressure is there, right? The peer pressure is there. And so the parents can say to the children, look, as long as you do your best, I'm happy. However, society demands, yeah? And I remember speaking about this to my daughter, and she said that when I was doing my GCSEs, it was the end of the world, yeah? That if I fail now, then I'm a failure for the rest of my life. And sometimes each step of your life, society puts so much pressure on you that if you do not get this done, if you do not achieve this, that's it, your life's gone.
You see, the pressure is right to an extent, I mean, because you need pressure to work.
You look back at when you did your... probably O-levels then, wasn't it?
O-levels.
When you did your O-levels or whatever it was at that time it was the be-all and end-all of everything. That, look, this is it. You know, if I don't get through this, I'm a failure. And then every step of your life, this pressure that's put on you is good in one sense, but that pressure can have adverse effects as well.
I think that pressure is normal in life. It's just that some individuals, especially in this society, the fast life society we live in, take that to an extreme where failure means death. That's the difficulty.
It is. I mean, not death. It's like the end of your life, and that end of you're never going to be a success. You're going to be a failure for the rest of your life. It's not as if but then that thought can I'm going to be a failure for the rest of my life. I might as well.
So basically, this is one of the things is that one very important skill for parents to teach their children from young age onwards is how to accept failure.
Yes.
I'll give you sometimes it makes you feel good or whatever. I mean, sometimes you do give personal examples. I would like to share this personal example with viewers of Madani Channel. The other day, my daughter, she's 9 years of age. I think it's correct, 10.
You'd be in big trouble if you're wrong, mate, I'm telling you.
So you're not going home tonight.
We were going to visit
She's going to be waiting for Dad to come home.
And she got dressed, and obviously she... whatever he wanted to, because obviously daughters, the girls are very sort of like, and she comes to me and she goes to me, Baba, how do I look? Now obviously I knew that she's expecting me to say, brilliant, you look lovely or fabulous or whatever. I intentionally said to her, you look different. She goes, so do I look bad? I said, well, how can you look bad? All I said is you look different. And then she kept asking me, how do I look? I said, beta, you looked at the mirror before you came to me. How did you feel at that time? Because I know that when you put on an appearance, you are comfortable with that. That's why you put the appearance on. I felt this as an opportunity to teach my daughter that, look, others' comments don't matter. It is what you feel and what you believe. And I told her that, look, where we are going, some may say you look very good, some may say you look not good. And girls are very sort of like sensitive to these. And I was trying to tell her, if you are happy, if you are comfortable with this, then doesn't matter what others say. And even if when we go there and someone comments negatively, you are going to say, I'm comfortable with this. This is my situation, this is my life, and I'm happy with this. This is in essence what I was trying to teach her was that, look, you could perceive another situation as a failure. Why? Because someone said something. But I'm training you to actually, if you are happy with this, you are happy with this. Doesn't matter what other people say. And this is also a big problem in our society, what we call as a rat race. He's got, I don't know, this car and I'll get this car. He's got that big house, I'll get that big house. Now, I can tell you there are millionaires and they're not happy. Why? Because someone is one step ahead of them.
Very few are.
And there is a poor one who's very content with his life. He's getting brilliant sleep. He's only eating one roti in the morning and one in the evening. Right? Why? Because he isn't into that rat race.
He's happy with what he's
got. And it is what obviously you started at the beginning, is how to condition our thought. In Islam, we should have our friends. We should be friends with those individuals who are, I don't know how to convey it, but I just want to convey it in a positive way. That we should actually be friends with people who are less rich than us. We should go to their homes. I'm not saying you don't go to, but what it would do is that if you go to those homes where people have got less luxuries than you will automatically be content with what you got. But if you go to, let's say I'm a doctor and I go to a neurosurgeon or a vascular surgeon's house and he's getting paid more than me and his house is bigger than mine, and then I will be definitely thinking, am I a failure? But that's my problem, that's my negative thinking. And clearly, where we started off with this was that we need to condition our thoughts. In this sense, it's the perceived failure. You are successful in the eyes of the other, but you are perceiving it to be a failure. Don't be happy. And also for the parents, one of the biggest skills that they can teach their children is how to accept failure and how to deal with the emotions and the comments from others. Many times parents do need to protect their children, and sometimes they need to answer particular individual on the behalf of the child. Because adults in our society, when someone becomes religious, there are all sorts of negative comments. And other people are actually saying these things to these children and their parents are not protecting them. And this child feels very vulnerable. That other people are coming and saying things to you and your parents are not protecting you. This leads to low self-esteem, low self-confidence, lack of trust with parents and so forth. So, I don't know where we started off and where we ended.
Viewers of Madani Channel, on Tonight with Madani Channel, today we've been talking about suicide. We're coming to the end of this segment now. And really, at the beginning I thought to myself that how are we going to talk for 1.5 hours on this particular topic? But there is probably, on some articles that I've read, that there are probably more than 60 reasons, 60 various reasons of why people commit suicide. And I think we just touched on some of them, but I think a lot of them is how you condition your mind and what you do with your time as well. And Harun Bhai and both of the brothers here have said that if one of the best ways of hopefully relieving this stressful life, because we live a stressful life, life is very, very stressful now, and things do get to us, is one, taking time out, finding time to be able to give your own self some time. I remember Nigarani Shura once said that, you know, as Muslims, we should divide our time into 4 parts. And he didn't say that these 4 parts should be equal, but he said that these 4 things need to be part of your life. In the same way that if you make something to eat and it's got to have salt in it, it's got to have pepper in it, it's got to have this in it, it's the quantities doesn't matter, but it needs to have these things. And the 4 things he mentioned were that 1, you need to earn money. We all need to earn money. 2nd, we need to give time to our family as well. And 3rd, we need to give ourselves personal time, that personal ibadah, that personal study, that personal worship where you can connect with your Lord. And as we're talking today, that this personal connection is something that can relieve all of these problems. And 4thly, is giving something back to the community where we do the work of Deen, do the work of Dawah Islami, and actively become a part of this. The brothers have already mentioned some of the activities that Dawah Islami has that can help us in relieving these problems. We're now going to go to our next segment of our program, which is the proverb of the week.
Tonight with Madani Channel.
Birds of a feather flock together.
Birds of a feather flock together. Now, for Dr. Zina, this is the first time you've seen this, yeah? I love it, you know, when we put these proverbs up. And just before we start this, I think last week or the week before, we had somebody that sent us a comment that, you know, we're talking about a very, very serious topic, and then we kind of change the mood completely and we become a little bit more relaxed. I think that's the general idea that we have here, that, you know, we don't want to be all serious all the time. We want to have a little bit of, you know, something that we can discuss amongst ourselves as well and not be as serious. So this is the proverb of the week, and what I'd like to put you on the spot, Dr. Saab, because it's brilliant. You know, the last couple of weeks I put Harun by Officer Fakat on the spot. He's never seen the proverb before. He doesn't know what it means and what his take on it. So I would love to hear what your take is on this particular proverb of the week.
I'm thinking of what is the Mir Puri alternative of this, but it's not coming to my mind.
No, don't forget, we don't want a Mir Puri. That's the other thing that we've been criticized, Dr. Saab. We have been criticized that we don't stick to English, and we are going to stick to English. So I don't want your Mir Puri alternative. I don't want your Patwari alternative.
For the last 92 minutes we've been speaking in English.
Well, keep it up then. You can do it for another 28, inshallah. Birds of a feather flock together.
So, do I talk from a mental health point of view?
You can talk from whatever point of view you want. What does that mean to you?
To me, it means the people who got similar minds, similar ways of thinking, similar ways of dressing, similar ways of behaving. And if, let's say that there was a crowd, and a crowd of 100 people, and you said that none of them knows each other, and you gave them 10 minutes, within 10 minutes people should actually sit down with someone, and generally then there may be 10 groups or whatever of 10, and if you look at why is it that these 10 sat here together,
there'll be a common theme.
There will be common themes. So whatever the common theme is, someone may be wearing a shirt that represents particular sports, someone may have a hairstyle which represents a particular, or someone's actually smiling in a particular way, someone's walking in a particular certain way. So these are, there are all sorts of things. They may be saying something verbally, there may be body language, there may be other signs and symptoms that you can actually then look at them and you think that I will be comfortable with that individual, and most of the time these people will be right.
Harun bhai,
I want to bring in a different angle here.
Go on, your take on this one.
Birds of a feather flock together, so similar sorts of people are together. Now, throughout our lives, as we were youngsters, our parents always said, stick to the good people, stick to good company, stay away from bad company, because even if you're good in the bad company, you will stand out and you will get into trouble, and it's those around you. And so my take on this is that it could refer to, or you could take it as interpreting that if you are sticking with the wrong people, you're part of that crowd.
Yeah.
Whereas if you stick with the right people, you will become part of that crowd. And, perhaps with the bird analogy, it's different because birds look similar, but you, as a human being, you've been given that ability to adapt. So if you are, for example, with the gangsters on the street and with the people who carry knives like we did last week, or other people, or even to an extent, Dr. Sawin, you will props, accept this, that if you're amongst people who are suffering from depression and have a lot of negativity, if you stick with them, you'll end up the same, because it catches on. Whereas if you're in an environment that's positive, if you're with people that are always positive, people who are always talking about Allah and His beloved Habib sallallahu alaihi wasallam, people who are always running to get to the masjid, running to do good deeds, running to comfort others, running to help others, you are part of that flock, and you will get the benefits of being there as well. So that's my take.
Birds of a feather flock together, mashallah. I think my take of it is that you see, here in the UK, that when our communities came to this country, they did flock together. They did, associate. Because why? Because they feel comfortable there. So birds of a feather flock together because of the comfort, because of the commonality that they have amongst them. And we see that as well. But again, I'm going to say to you that all the birds that are out there, come and join this Mahola Dal Islamiyan and be together. Because, if as an individual, you are that, you are basically that, you are an individual. And you may feel that you have the strength to be an individual, but we all need to flock together. We all need to be with other people as well. This is part of our, build-up, that we need to be with people. We need to associate with people. We need to socialize with people. And if you socialize with the right people, like Hanbai says, then that will have an effect on you. I've always said that, as an individual, we're a brick. This is the example I've always given. As an individual, we're all bricks. And if you make a wall of just bricks, it has no strength. You just put the bricks up and put them on top of each other, you can push the wall over. The strength is in the cement. By joining them bricks together with cement, the wall becomes strong. And I say to the brothers that the mahol of Dal Islami is that cement. So by joining yourself with other people, it gives you that strength, it gives you that comfort, it gives you that peace of mind. And we've been talking today about peace of mind, and we've been talking today about comfort. And if you want to be having that peace of mind, then you need to be with them people that have peace of mind. If you're with those people, like Harun Bhai said, you're with those people that are on the street, that are constantly looking over their shoulders, looking over that somebody's going to attack them, looking over that somebody's going to do to them, you're never going to have peace of mind. So, yes, birds of a feather flock together, but you as a bird can decide which flock you join. And that is the decision that we need to make. We need to make that decision in our life, that yes, I want to be associated with this group, or I want to be associated with that group. And, we talk about it many, many times, that as Muslims, we need to really think about, who do we associate with? Who is our flock, if you want to use the word? Who is the flock that we flock together with? Who is the people that we hang out with? Are there people that, when we think about them, we think about cars, we think about money, we think about nights out, we think about girls, we think about parties, we think about alcohol, we think about drugs. If that's what you think about when you think about your friends, then one thing I can tell you, viewers of Madani Channel, they are not your friends. They are not your true friends. Your true friends are those people that when you think about them, you think about the masjid. When you think about them, you think about returning to your Creator. When you think about them, you think about the things that they have taught you, that you need to be preparing yourself in this world for when you enter that dark and lonely grave. So this is the take of birds of a feather flock together. Finally, we're now going to our last segment of the program. And the last segment of the program is Madani Pearls from Fazana Madina Manama magazine.
Madani Channel.
Viewers of Madani Channel, Madani Pearls from Fazana Madina Manama magazine. Now, the Fazana Madina Manama magazine is a magazine that comes out every month. It can be delivered straight to your door. And in this Manama magazine is such that it's not something that you pick up, like sometimes when you pick up a book and you think to yourself, how am I going to get through this? This Manama magazine is something that you can pick up, you can read for 5 minutes, you've learned something, you can put it down, pick it up again later on for 5 minutes and learn something else. In the last couple of weeks, we've talked about some of the Madani Pearls from the Madani Muzakaras. And the Madani Muzakaras are those events that take place every Saturday night or special occasions where Amir al-Sunnat, questions are asked to him, and in response to them questions, he gives us his Madani Pearls. Today we're going to take another article from the Fazana Madina Manama magazine. It's an article regarding weeping over the demised people, weeping over dead people. And this article is in the current issue of the Fazana Madina Manama magazine. And this particular article was written by Mufti Muhammad Hashim Khan Madani, inshallah. So I'm going to quickly read this, and hopefully we'll get some Madani Pearls with regards to this. It says here that the Prophet of Allah sallallahu alaihi wasallam said, "Don't you listen? Certainly Allah Azza wa Jal neither inflicts punishment for weeping tearfully, nor for grief in the heart." And after pointing towards the tongue, the Prophet of Allah sallallahu alaihi wasallam said, "However, Allah Azza wa Jal will inflict punishment or have mercy because of it, and certainty, punishment is inflicted on the deceased person because of the wailing of his family members for him."
Allah.
And what we're talking about here, my viewers of Madani Channel, is wailing over the deceased. Here we are told here that the Blessed Hadith contains the description of three things. It says that there is no punishment for weeping tearfully, nor for grief in the heart. In fact, one weeps tearfully or has grief in his heart because of mercy, and he will be granted a reward for these two acts. However, if someone says something which Sharia does not permit, then he will deserve punishment, such as wailing for a deceased person, i.e. crying loudly. And if he says something good, he will be granted a reward. Thirdly, if the family members of the deceased person wail for him, this causes punishment from him. The commentators have mentioned it in several meanings. The punishment is to be inflicted on the person who makes a will for wailing for him. So if someone makes a will and says that, when I die, I want you to wail for me, I want people to wail for me and cry for me, then that person will also be punished as well. Punishment means the pain and suffering inflicted on the deceased person when he hears his family members wailing. A legendary and leading scholar, Mufti Amjad Ali Azmi Rahmatullahi Ta'ala stated, wailing means crying loudly while telling the attributes of the deceased person exaggeratedly, and this is unanimously haram. Now this is an act that maybe, I don't know if you come across this, Dr. Saab, where it happens where within certain communities, you sometimes hear the sisters, the women, that when somebody's passed away, they cry and they wail, and I don't know what they're saying, to be honest. I've gone to, you hear them.
Tragic.
It is, people say these things, and it comes to the point where it's almost poetic, and I don't even know whether I should use that word, but it comes like this. There are 5 sayings of the Prophet of Allah sallallahu alaihi wasallam. I just want to give these 5 sayings to the brothers here and to our viewers. There are 2 signs of kufr, disbelief, in people. 1 is taunting anyone about his lineage, and 2, wailing for a deceased person. Number 2, cursed are 2 voices in the world and 2 voices in the hereafter. Music at the time of blessing and wailing at the time of trouble. The wailing woman who does not repent before her demise will be made to stand on the day of judgment with a kurta of sulfur and a scarf of each on her body. In another hadith, the Prophet of Allah sallallahu alaihi wasallam said, on the day of judgment, there will be 2 rows of the wailing women in hell. They will be barking there at the right and left side of the hell dwellers, as dogs bark. In another hadith, he says, the Prophet of Allah sallallahu alaihi wasallam said that I have heard enough of the one who shaves off the head, the moustache or the beard, and shouts and tears his breast, I part of his clothing that covers his chest. As some people, when they are wailing, they rip their clothes, they shave off their hair, they pull their hair. My viewers of Madani Channel, this is completely forbidden. It is against the teachings of Islam, and unfortunately, it's something that still occurs to this day age. It's something that I remember when I was little, when I was in Pakistan, I saw it there. Maybe in this country I've not seen it much, but occasionally you go to someone's house and you're in the front room with the men and you hear the wailing in the back room. And it's sad that, this is a wake-up call for us, that we're away from the deen of Islam, that our family members, those people that we are grieving for, in fact, rather than helping them, you're causing punishment for them, you're causing problems for them. So we are told that there is mercy in crying. There is nothing wrong in crying. There is nothing wrong in grieving, and this is a natural thing. To grieve and to cry for the deceased is natural. However, wailing and screaming, wailing and ripping your clothes, wailing and pulling your hair out, wailing and scratching yourself, you people scratching themselves, doing all these things, these are all forbidden acts of Islam, the viewers of Madani Channel. So please, I ask you to refrain from this particular act. Have you?
It gets worse, unfortunately, Khalid, because what you have is, what we're talking about there is people shouting and screaming, and basically what they've done is they've lost the sabr, the patience that we are ordered to have.
Is it that though, Haroon? Sorry to interrupt. Is it that, or is it because it's a habit?
It's almost a culture now, because in the culture, if you don't do it, it's as if you haven't reacted properly to the death. To it. So
I know it's wrong to wail, but part of me can understand it if it's genuine, but I'm sorry to say, I don't believe it's genuine. I believe it's cultural. A lot of the time it's cultural as well. The worst thing about it is this, that some of the things that they say, this is bad enough, wailing, crying, it's wrong, it's prohibited. But the words that they speak, oh Allah, how could you have done this? Oh.
Or, the kufriya kalimat that come out. A lot of these people, and then they ask the question afterwards, I didn't know what I was saying. Well, you're responsible for what you say. And they come out with all these words that are, could take them out of the fold of Islam. in that moment. And it's not the fact that you've lost a relative. And there's that famous hadith of Mubarakah where, there was a Sahabiya who'd lost sons, I think, or relatives, and yet she was so calm with parda and everything. And they said, you are so calm in this state. And she replied, I've lost my sons, I haven't lost my haya.
Allahu Akbar. Allahu
And
Akbar.
yet today, when you see it so many times or you hear it so many times, you're sat in the front room, and you can hear the sisters in the back room shouting and screaming and saying these types of words. And, it just, they don't realize what they're doing. And they're causing, obviously, mercy to disappear from their household, but they're causing punishment or pain for the deceased as well.
The funny thing you mentioned about the fact that people can lead to kufr. Someone told me recently that someone quite young had passed away, and there was an elder member of the family, and she's wailing and saying that, it should have been me that had gone. I'm the oldest one of the family. I'm the one that should have gone. Why did he go? And again, this questioning the will of Allah Azza wa Jal. It's one thing, to question the will of Allah that takes you into the fold of kufr, but at the same time questioning the will of Allah Azza wa Jal and wailing as well, you're causing grief to the deceased. And again, I just can't get my head around this, Dr. Saab. Have you come across this?
No, clearly, obviously, my upbringing was in Pakistan, and
did it occur there?
I have seen it, quite frequently, and very, vivid memories.
I've seen it very rarely, to be honest. It's been very rare.
I'm from Punjab myself, and I don't know whether, but in our community, it does happen. Now, in Urdu, it is called ban karna. Ban. Because some of the viewers who will be watching us, they may not understand English, and they are the ones who are actually doing it. Because my own personal experience, I hope I'm right, is that the younger generation's moving away from this. I hope I'm right. Now, just to look at, I know it's a very serious topic, but it is. I will agree with you that it is more of a fashion. And people are actually, if you don't do the ban and you don't sort of like make people cry, then the women will actually blame you that you're not actually sad enough.
I know from an outside viewer, so to speak, and what you just said, it might appear comical, it might appear funny, but there's a serious side to this that what people don't realize and what people need to realize, and viewers of Madani Channel, please realize that if you are doing this, then you are not helping the deceased in any way. You are causing harm, you're causing pain to that deceased person. And, that is obviously the last thing that you want to do. And I'll just give you an example. If the dead body was there and I started hitting the dead body, you won't be happy with me. But you wailing, you could effectively be doing that. And, the punishment that I'm giving that dead body is probably nothing to the punishment that dead body is getting because of your wailing.
On the positive though, Khalid Bhai, I've attended some funerals where the Islamic sisters have been amazing, where, the recitation of Durud Pak, Parda, they've kept away, and you haven't heard them at all, even though a close relative has passed away. And then from what I learned from family and from my mum is they stayed there all night reading the Quran. And alhamdulillah, it comes full circle. But these are Islamic sisters from the Madani Mahal of Dawat Islami. And what had happened is maybe without the Madani environment of Dawat Islami, they may have been in those old traditions that we brought with us. But they were there. And they said it was amazing. One person said to me, I wish when I die somebody does that. They sat around all night reading the Quran, reading Surah Yasin Sharif and everything, and doing the zikr of Allah Azza wa Jal, and it was amazing. And not one person was wailing, leaning over the coffin or anything else, and it was done in a proper way. And kashke, that happens.
I think coming back to basically what we said all night, that the crux of our problem is the fact that we have this lack of knowledge, and because we have this lack of knowledge, then cultural things are brought into our way of life, and because of these cultural things we start committing all these sins. And this particular sin that we are talking about, what is scary about this particular sin is that not only are you committing a sin, but this particular sin also affects the person that you are grieving for, the person that you have lost, your close relative that you have lost. So my humble request to all of our viewers on Madani Channel now that one, if somebody does pass away, then we are told that there is no harm in crying, there is no harm in grieving. This is a natural thing. But my humble request to all of our viewers, please refrain from wailing over the deceased, because this affects this disease, and the deceased are punished for this. So I think we all need to educate ourselves, we all need to refrain from these. And also my humble request to the sisters that are watching as well is that when you are in a gathering and you see people that are wailing, then have the courage to stop them for the sake, with the intention that you're stopping that person committing sin, and you're also with the intention that, inshallah, that the deceased will benefit from you by stopping that person. And we all need to have this courage inside ourselves, not just in this particular instance, but in any instance in life where if we are seeing that something is going on wrong, then we should have the iman, the strength inside ourselves to try and stop it. And if we don't have the strength inside us to stop it physically, then there's a hadith that tells us about trying to stop it verbally or in writing. And if we can't do that, then at least have this feeling inside your heart that what is going on in front of you is wrong, and that is the weakest iman. May Allah give us the ability that we can actually stop what is happening around us. And I think this really is a Madani pearl for all of the ills that are happening in society. And I think another thing that I picked up on early on from what Dr. Saab was saying and what you were saying, and I was going to bring it back, that over the last 3 weeks we've talked about certain topics. In the first week we talked about respecting our elders, and the second week we talked about knife crime, and today we talked about suicide. And one of the major cruxes in all of these 3 topics that we discussed this week is the breakdown of the family unit. The family unit needs to come back together. The family unit needs to prioritize what it is doing in its life and give time to the family. And if we start giving time to our families, giving time to our children, then inshallah we will not face the problems that we faced when we talked about in the first week where we've got old people in old people's home. We won't face the problem that we talked about in the second week where we're saying our youngsters are going to be out on the street, committing all sorts of crimes. And we won't face the problem that we've talked about today where our youngsters in particular don't feel like there's nobody that they can talk to. We need to build that relationship with our family. They are our family for a real reason, that we need to have that relationship. The father-son relationship should be such that the son can come and talk to the father at any time. The mother-daughter relationship should be similar, that whatever happens, she can go and speak to her mum 24/7. She should not be afraid. But the problem is sometimes the son is not afraid, the mother is not afraid, but the mother and the father are just not there. There's no time for them. So we need to start giving our family time. We need to give them this so that, inshallah, that they can resolve these problems so that we don't have these issues. And unfortunately, we're seeing a breakdown in our society. And I pray to Allah Azza wa Jal that the problems that we are facing as a community around us, these problems and many other problems, a lot of it comes down to our priorities in our life, that our priorities are such that we're running after things that really are not benefiting us. And we talked earlier on about those people that are running after the wealth and running after these times. And because people are looking at that, then they're thinking that that is the ultimate goal. So we need to realize what our ultimate goal is, what our ultimate purpose of creation is, and then inshallah Azza wa Jal will see a difference. Viewers of Madani Channel, you've been watching Tonight with Madani Channel, and today we've been discussing the topic of suicide, and I hope and I pray that we have learned something today. It is a silsila that we could have carried on and talked about for many, many hours, because there's so many reasons that cause this action of suicide. And I pray to Allah Azza wa Jal that the suicide rate does fall within our community, and that it becomes something that we don't even need to talk about. And I pray to Allah Azza wa Jal that happens pretty quick. I hope and pray that Dr. Saab, that he has given us time today, in future can also give us time, and I pray that Allah Azza wa Jal accepts that time that he's given. Amongst the 3 of us, he's the one that's travelled the furthest, and amongst the 3 of us, he'll be the one that gets home the last tonight. Keep watching Madani Channel. Save your iman. Stop backbiting. The war against backbiting will continue.
Inshallah.
Keep watching Madani Channel. Sallu ala al-Habib.
Sallallahu ta'ala ala Muhammad sallallahu alayhi wa sallam.
Let your heart shine bright. Let us take you to what is right. Let your heart shine bright. Let us take you to what is right.